Hi everyone, I'm Dr. Suruchi Agarwal. I'm a pediatrician here at Columbia Asia Hospital, Whitefield in Bangalore. Today we're here to discuss with you the questions that have come forward from our parents about their health and the well-being of their children during this COVID-19 pandemic.
Ma'am, does COVID-19 affect children?
As we all know, the coronavirus 19 is a respiratory virus, so it spreads via droplets when you cough, sneeze, or talk, or touch surfaces where there are these droplets, and then touch your face, especially your nose, your eyes, and your mouth. Now, fortunately, all over the world, approximately 2% of children have been affected. Now, that's a very small number, so that's reassuring. And most of these children have had no symptoms, which means although they have the coronavirus, they have had no symptoms and are well. But that doesn't mean that it stops them from spreading the virus, so it's important to take all the universal precautions.
What are the symptoms of COVID-19?
Being a respiratory virus, the main symptoms are a fever and a cough. Some children will develop a runny nose, some may have some body pain. Very, very rarely do children develop any symptoms of their lungs.
What do we do to prevent them?
So the universal precautions you've been hearing of over the last 3 months, you wear your face masks, you maintain social distancing, wash your hands with a soap for 20 seconds at least, and use an alcohol-based sanitizer. Apart from this, especially in children, maintaining and increasing their immunity is important. So fresh fruits, vegetables, keeping junk away, eating sprouts, exercising is extremely important.
Kids are fussy to wear their mask.
Yeah.
Should they wear mask?
This is a debate that is unending. So kids and masks are something that they've never done before. Children under 2 should not wear masks. They can suffocate, the mask can cover their nose. But above 2, up till the age of 5, you have to try, like we do with everything. So give them a mask, let them decorate it, tell them why they're wearing it. Tell them they're superheroes protecting other people by wearing the masks, so they don't spread their droplets, they stay inside and they protect everybody. Kids love playing superhero. Get them a superhero mask, use a comfortable cotton mask. None of the N95, N99, no, we don't need any of those. Just a simple organic cotton mask will do. Masks have to cover their nose, up to the bridge, down the chin, and on the sides in front of their ears. Better to use something that you can tie at the back rather than with an elastic. It helps them be more comfortable with it.
Parents worry about bringing their children to a doctor,
Yeah.
to a hospital. So what is your suggestion to them?
It's quite understandable that you're worried taking your child outside the house at all. Forget about coming to the hospital. That's the last place you want to be. But remember, most of the hospitals, their patients are actually their priority. So utmost care is taken to keep you safe. Even when you come into the hospital, apart from the screening at the entrance, there is social distancing, everybody wears masks, the staff is in personal protective equipment. One thing that we request you to do for your kids is tell them that their favorite doctor is going to be dressed up differently. They're going to be in a face covering, so a mask, goggles, a face shield, sometimes a gown, and look very different. Most of the kids are fine, they think of us as robots and carry on, but some of them do get extremely anxious. So talking to them, showing them a picture of a doctor in a PPE will help. From our side, we use our voices to make them as comfortable as possible.
During this period, can we delay vaccines?
The short answer is no. We all know vaccines are against the most life-threatening preventable diseases. So as usual, delaying it by 2 weeks, 3 weeks is okay. But beyond that, you are making your children more prone to these vaccine-preventable diseases. So speak to your doctor, talk to them about the efforts the hospital is making, and choose the right time to vaccinate them. Come in and get it done. It's important. Let's not delay them.
It's 3 months' time now, the kids are at home, and the screen time is something which is there for them as online classes. So what is your advice in this situation?
Online classes have got their pros and cons. Children have to continue with their education. So some children are spending 3 hours every day, some 6 hours, and some 7 hours. It's important at that time you let them sit in front of a computer, but beyond that, screen time should be 0, because it does affect their eyes, and generally headaches, body aches become a common scenario in this situation. So screen time is only during online classes. Beyond that, engage them in regular exercises. Now, you ask me, what can you do when you're locked inside the house? Yoga, skipping rope, hula hooping. You could do dancing, that's a good one. And if your community allows, you can go down cycling, remember with a cotton mask again. Now, with respect to other activities, board games are becoming popular. That's a good pastime. Get your kids into reading books. Now, with everything available easily, there are exchanges happening within the apartments. Get them to read. And remember, healthy food. That's important. While you're stuck at home, it's easy to reach for that packet of crisps or make a pizza, but it's better that you stick to fruits, veggies, dips, nuts. That's very important.
Some worrying syndrome is being heard these days, and what is your point on this?
The internet is funny, isn't it? So I'm sure before us doctors, everybody else heard about this syndrome. Yes, absolutely. There is reports emerging about a syndrome that is affecting children from around 4 years to 15 years. Now, this syndrome presents as fever, and it is known as a multisystem inflammatory syndrome. Now, as the name suggests, it affects various symptoms in the body. Who gets it? We don't know. Why children get it? We don't know. But a very, very small number of children have been reported to get it, especially in Italy, France, Spain, and the UK. Now, these children have presented about 3 to 6 weeks after the pandemic's peak. So it shows that it is not the acute infection that is causing it, but after it. So it might be a hyperimmune response of their immune system. There's a lot of research going into it, so we have to wait and see what comes out. But if your child develops a fever for more than 3 days, has tummy symptoms like diarrhea, vomiting, or tummy pain, has a rash, has redness of their tongue or eyes, complaining of body ache, or any symptom that may be worrying, come into the hospital, let us investigate and see. But again, to reassure you, it's very, very rare. We have only a few cases reported all over the world.
Anything else to add on?
I think in conclusion, I would say, yes, we are in the middle of a pandemic. The good thing is not many children are affected, but we have to still stay safe, keep our children healthy, and continue with their regular routine in a different way. Thank you.